name is Rachel Roth. I'm Senior Director of Grants and Programs at the Foundation for Financial Planning. We're so pleased to be here today for a webinar on helping clients navigate public benefits and social services. This webinar and the others in this series are eligible for CFP and AFC continuing education credit. We'll submit the CE credit to the CFP board for all the CFPs out there. The AFCs in the audience will need to submit to AFCPE themselves, and I'll let you know the code for that at the end of the webinar, and we'll also send a follow-up email. I know we get a lot of questions about this as well. We will be sending out some additional resources, a few of the presentations of our presenters after the webinar as well. And then I also wanted to thank BlackRock for sponsoring this webinar. And I'm going to share my screen. Before I introduce the speakers, I want to spend a few minutes sharing some information with you about the work that FFP does to expand access to pro bono financial planning for people in crisis or need. Switch to the slide. Okay. As you know, millions of Americans struggle under the burden of financial risk. More than half of Americans don't have savings to cover a $1,000 unexpected expense. 4 in 10 feel anxious about their debt. And of course, there are groups that are especially at risk. People facing serious illness, victims of natural disaster, women, veterans, members of the military, and others. Our mission is to help people in need improve their financial lives by expanding access to pro bono financial planning. We've been around for about 27 years, and we're solely devoted to creating better access to quality financial advice and guidance. We do that in a number of ways. We provide grants to local, regional, and national nonprofits to support programs linking financial planners to people who need help. We activate and connect volunteer financial planners to pro bono opportunities, including for our platform, probonoplannermatch.org. We develop signature programs with key nonprofit partners to reach populations where we can have a big impact. We raise awareness of the importance of pro bono financial planning, and we also offer financial planning resources free of charge to people in need, to the nonprofits, and to the advisors that are helping them. In terms of the resources that we offer the Pro Bono Financial Planning Volunteer Training. It's a free 50-minute online module that helps financial planners understand the basics of how to provide pro bono service. We provide worksheets, webinars, user-friendly disclosures like letter of engagements, and more. We recently, well, I guess not so recently, in the past 3 years, we've developed a platform called probonoplannermatch.org. It's the first of its kind platform connecting CFP professionals with volunteer opportunities at nonprofits nationwide. And then we also offer E&O liability insurance, which is complementary to CFP professionals who connect with a pro bono opportunity through Pro Bono Planner Match or volunteer with any of FFP's grantees. We encourage you to check out our website. We have a volunteer page, and we have an extensive resources section on our website that serves a variety of stakeholders. So we encourage you to join the pro bono movement, sign up to volunteer on Pro Bono Planner Match, stay up to date of things going on at FFP by signing up for our newsletters on our website. And of course, we rely on your financial support as well. So feel free to support our mission. And if you have any questions, you can reach out to me. My information is here below, or our CEO, John Dauphiné, or our Vice President of Development, Katie Hammer. So without further ado, we're thrilled to have a fantastic panel here today with us for helping clients navigate public benefits and social services. I'm really excited about this webinar. I think the information is going to be so relevant and definitely fills a gap in some of the resources we have offered in the past. We're excited to have Amber Castor here, Program Coordinator from Volunteers of America, Texas. Ellery Maku, Program Officer at LISC, Local Initiative Support Corporation, a grantee of FFP. Colton Naval, Community Engagement Manager at Find Help, and Shoshana Martyr, Senior Program Lead and Product Manager at the LEAP Fund. I'm gonna so briefly, I'll probably skip through this agenda. We're gonna and let our presenters take it from here because we have a lot to cover today. And with that, I welcome Ellery and Amber. And I'm going to switch the slide deck here.
Hi, everybody. Thank you for joining us today. It's such a pleasure to be here. And especially thank you to anyone who is joining from Houston. And thank you to the Foundation for Financial Planning for hosting this webinar. Such a pleasure. My name is Ellery. As Rachel said, I'm with LISC Houston, and I'm going to tell you about some of the benefits and perceptions around benefits with my colleague, Amber Castor, who's representing Volunteers of America, Texas. Next slide, please. So an overview of our section, we'll discuss benefits, talking with your client, and how our community center partners assist clients. Next slide. So first, some questions for you. Could you please type your answer in the chat? Just a little way to get involved. And there's no wrong answer. So you can select an answer to one or more of these questions. What is your experience with benefits? How do you feel talking about benefits? Do you know what benefits are available to the public? And what comes to mind when somebody says public benefits? So again, throw your answer in the chat to one or more of these questions. I'm seeing a lot of people not very well versed, limited experience, some experience. Thank you for your engagement, limited experience. Understood. All right. Some people host events, still learning. All right. Okay. So some people start late in learning about and saving for benefits. That's good. Okay. All right. Thank you for all the answers in the chat. Keep them coming if you'd like. There's a lot of perception around public benefits, including Cadillac Queen, which I just learned about, and Welfare Queen, a lot of judgment, a lot of bias. Sometimes people feel uncomfortable discussing benefits. Maybe you're not judgmental, and you just want to know what's available. It looks like a lot of folks that are joining us today just don't know what's out there. Their information is limited, or you don't know how to start a conversation with clients, and we're certainly going to go over that as well. Thanks again for your participation in the chat. Yes, there's a lot of stigma that should not be applied. Thank you. Next slide, please. So as a knowledge check, I live in Harris County. More than 500,000 people out of 4.73 million people in Harris County are eligible for some type of benefit, but are not using them. And there's almost $1 billion in public benefits assistance that goes unclaimed each year just in Harris County. So that's just one county. That shows how much money in potential benefits to families is left on the table each year. Millions and millions of dollars. Next slide, please. This is a little bit of more detail on how much goes unclaimed and how much is left on the table each year. So here are some programs that are available in Harris County and the cost per person. How many people, thousands and thousands and hundreds of thousands of people that left benefits on the table, and millions of dollars. Some may not be as much nationally, but you can see how much in terms of benefits are left unclaimed. And now I'm going to turn it over to Amber to talk about some specific benefits.
Good afternoon, everyone. Now that we've shared how much money is left on the table, I'm going to discuss the 8 benefits that are generally available nationwide. On the screen, you can see the list of those 8 benefits. Next slide. Okay, so first we have CHIP. CHIP is usually for dependents under the age of 19. Dependents enrolled in CHIP are more likely to get checkups, and the rate of uninsured children has dropped since the program has started. So on the slide, you can see that children enrolled in CHIP are 25% more likely to get checkups, and that all the things that CHIP provides, which is routine checkups, immunizations, doctor visits, and the rest on that list. Next slide. So next we have the housing voucher program. This program is for, of course, for housing, and eligibility depends on the type of household, financial status, citizenship status, background, rental and criminal history, and also other factors that are determined by HUD. HUD stands for Housing and Urban Development. Next slide, please. Next, we have Social Security. There are 2 forms, which include Social Security Disability Insurance, and the other is Social Security Income. SSDI is for individuals who can't work due to a medical condition, and they're able to receive Medicare after 2 years. SSI is designed to meet the basic needs of individuals that have little or no income, and they're able to receive Medicaid after 2 months. Okay. Next slide, please. Okay, now we have SNAP. SNAP provides nutrition benefits to needy families so that they can purchase healthy food. About 1 in 9 people participate in the US. 2/3 are families with children, and almost half are working families. That's very important because you can work and still be able to receive SNAP benefits. It's not only for people who have no income. Next slide. Okay, here we have TANF. TANF is designed to help families achieve independence following temporary hardship. TANF is cash assistance, and you're likely to receive help with food, housing, home energy, childcare, and job training. Also for TANF, they require participants to engage in some type of work activity. Next slide. Okay. Here we have Medicaid. Medicaid provides health coverage to millions of Americans. Children make up 50% of Medicaid enrollees, and non-elderly, seniors, and people with disabilities make up the other half. Next slide. Lastly, we have the Earned Income Tax Credit. This helps low to moderate income workers and families get a tax break. You can qualify under different credit types. For example, if there's a family that has children and they pay for daycare, then they're able to receive the child tax credit along with the dependent care credit. Okay, now that we've talked about all 8 of these benefits, I'll hand it back to Hillary to go over how to talk to your client about these benefits.
All right. Now that we've reviewed the major benefits nationally, let's explore why people may be hesitant to discuss benefits that may help them. I saw a question in the chat: why aren't people using these benefits or claiming these benefits? What do you think are some reasons? If you've had experience helping people access public benefits, what are some reasons that people might not access? And why do you think, you've had experience or not. Go ahead and answer in the chat. Awesome. So glad to see some. Yeah, some great comments coming in terms of why people don't engage with or claim benefits that might help them in their situation. Confusion, difficulty getting them getting into the process, complexity. They don't know that they're eligible, too confusing, not aware. That's awesome. Thank you so much. Please go to the next slide. So we captured some of your thoughts. The most common are hesitancy to identify what would help their family, embarrassment, not knowing what exists, and this legacy of bias and judgment about who applies for or who qualifies for benefits. You don't know until you apply. And in the case of TANF or some other benefits, it can be for a temporary situation. They don't have to be permanent. There's a fear of being judged and hesitancy to go after what's out there. The reality is that income supports can be a great thing for a family. They can help people overcome a temporary situation and can help a family just when they need a little bit of extra assistance. Language issues, that's a good one too. Thank you. Next slide, please. So if a family qualifies, they should feel empowered to use benefits. Here are some ideas for talking with your client. Keeping in mind that there's stigma, shame, embarrassment, language issues, fear of complexity or the process. What are some questions you could ask to get to the heart of the matter without reinforcing some of the stigma, negative bias or negative emotions? For example, you could ask if they file taxes, if they have access to the food they need for their family, if they have sufficient insurance to cover their needs, or if they know even how to apply for the benefits or what they might need to apply for. There could be some red tape, and sometimes clients are tired of the process. So even offering a little bit of encouragement or narrowing down what benefit would help them the most in terms of food or insurance or housing. You could offer encouragement or an alternative path, which other speakers will review, or simply just reinforce that benefits are available to be used and families should be empowered to use them. Next slide. This is back to Amber to talk about what our coaches do to help clients.
Okay, so as stated in the beginning of the webinar, I work for Volunteers of America and I work for the Financial Opportunity Center here. The Financial Opportunity, or the FOC, provides families with services across 3 different areas. One of those areas being financial education and coaching. So if there isn't an FOC in your area, you can also find a community organization that has a navigator program. Typically coaches within the FOC, they review the family's budget with them. They also ask the client if they like to be screened for any other benefits that they're not currently receiving. They use tools and information to screen clients, and later in this webinar, other presenters will review additional tools and resources that you could use with the client. Coaches also discuss what benefits they're likely eligible for and what they're not eligible for. They also explain each benefit to the client to ensure mutual understanding. They also submit information provided by the client to make applications easier. So with this, you can submit the client's information to the site or tool that you're using for them, or you can ask the client if they would like to complete and submit an application for those benefits themselves. Some clients need help with that and some clients don't. So just depending on the client that you have, you can either submit the document provided for them, or they'll do it on their own. Also, it's important that some coaches may have a referral partnership with another local organization for assistance with resource applications. And lastly, it's important for the coaches to stay in contact with the client and any other organizations for updates on the benefit status and applications. So next slide. Here is our contact information, just in case you have any further questions or want to get in touch with us. And now I'm going to hand it to Colton and talk about a specific resource site that you can use with your clients.
Thanks, Amber and Ellery. Gonna take the screen. Here we go. All right. Hello, everyone. Kind of echoing Ellery's comments at the beginning and just thanking you all for being here. Thank you to Rachel and Jordan for inviting us to come and speak. It's an absolute pleasure to be here speaking with all of you today about an exciting resource for both you and your supports that you provide to your clients, but a resource that they themselves can also utilize. My name is Colton Naval, and I am a community engagement manager with Find Help. And so this is the company that powers findhelp.org, which is the kind of website I'm going to be doing a hybrid demo overview for you all today. So I know, Cherie, I saw you posting the Q&A about passing Find Help along to your clients and counselors. But for those of you who don't know what findhelp.org is, I'm going to start with our mission, which is to connect all people in need and the programs that serve them with dignity and ease. And one of the things I always like to say is that this is a mission that we strive to embody in both philosophy and practice. So if the philosophy, again, is ensuring that any person in need of assistance can easily find and connect with those programs that provide those services. The practice is that we do that through a free website, findhelp.org, that really allows folks to find resources that are geographically relevant. So what that looks like is the ability to type in your zip code and find those free or reduced cost direct social care services directly within your own geography. So quick little bullets that you're seeing on my screen here. We have quite a bit of programs for over 1,400 for every US-based zip code, which covers all 50 states and US territories as well. We are 100% free for anyone to use to search and connect with resources. We also offer a whole host of free program management tools and features for the providers of those services as well. I just want to highlight a few quick benefits of using the site. Aside from it being an easy to use sort of open network tool that anyone can leverage, one of the pieces I really want to emphasize is our approach to kind of privacy and security. So we are a HIPAA compliant, FERPA compliant, and HITRUST certified company. We take that personal information and protection of personal data very seriously. We don't access personal information. We don't sell personal information. We want folks to have that sort of comfort and security, knowing that anything that they're doing on Find Help is protected and that personal info isn't being sold or shared. So now I'm going to hop into the live demo piece of the site. And while I'm doing that, I'm going to ask a couple of things. Well, first, I'm actually going to drop a link to the site in the chat. So for those of you who want to follow along with me, please feel free to pop onto the site. Secondly, if folks want to drop in a zip code and also maybe share some of the benefits that were of interest to you that resonated with you when Amber went over. And I see Candida, I'm going to take your zip code because it's the first one here. And then I'll just be on the lookout for some of those benefits that we can search for. And for those of you who are typing in zip codes, feel free to take those zip codes and plug them into your own web browser or phone if you'd like. Before I actually launch into this search, I just want to call out a few pieces here for everyone. First and foremost, the login. So you do not need to create an account to start using the zip code search and finding resources. We don't want there to be a barrier for folks to find help, and minimizing, the amount of clicks, the amount of accounts, the need to sign up. We don't want that. So you do not need an account to start using the site. However, I will say, quick plug, if you do create a free account, there are a whole host of additional free tools and features that unlock for anyone who creates that account. So just keep that in mind. But primarily, you don't, the main thing to take away here is that you or your clients can quickly and easily navigate directly to findhelp.org and start finding resources. I noticed someone in the chat earlier when Ellery was asking, what are some of those barriers or some of those hesitancies around discussing or getting connected with public benefits? Someone had mentioned language barrier. And so I just wanted to call that out too as something Find Help attempts to address through that sort of mission of helping all people in need with dignity and ease. We actually have a language translation option right here at the bottom of the home screen. So if I click this, you'll notice that there are over 100 different languages available to directly translate the site into. This is based on Google Translation Services. So a lot of that language functionality through Google is directly available on Find Help as well. Third and last, it's our zip code search. So as we've noted, Candida provided that zip code first to the finish line there. So I'm going to go ahead and click search. And what we're going to see is now we're actually looking at a number of programs that are directly available in the Bronx for that 10456 zip code. Now, a quick note on what these programs are and where we get them. So this 3,600, over 3,600 program number is reflecting local programs. So perhaps a Bronx specific food pantry, statewide programs. So perhaps, New York State's Department of Veteran Services or Department of Health program, and national or federal programs. So perhaps a USDA summer food program, an early Head Start type of program. Regardless of whether it's a national offering, a statewide offering, or a hyper-local offering, it is all related and relevant to residents living in that zip code. And how we kind of get at that sort of where we get programs and how we kind of verify and keep the accuracy of our programs up to date is directly through our own curation team. So Find Help has what we call our curation team, and every day they are going in to find programs that meet our criteria of being a free or reduced cost direct social care service. They're also looking to keep and helping review and keep information up to date on the platform. Though, as I'll show y'all here in a second, there are a variety of ways that we get programs listed and a variety of ways that you all can actually help directly add to our database and help keep program information up to date as well. But in general, just to kind of start and get us narrowed in, this is quite a lot of programs. And so in this example, maybe you're helping a client who wants financial assistance or has that food or housing assistance, a need for food or housing assistance. One way to start narrowing into specific searches is just by hovering over our different service icons. And as you can see, as I'm hovering different, oh my goodness, my camera wasn't showing y'all, I'm so sorry. Here I am. As I'm hovering over each of these different icons, you're seeing these kind of sub tags populate. And so again, this is just one way to help start narrow your search as kind of like in a prompted way. However, I will say most folks are just jumping up to our zip code search / keyword search / program name search. Really, what this search bar allows you to do is type in a new zip code if you wanted to start a new search in a different geographic area. You can type in different keywords. You can type in names of organizations or names of programs. It gives you that flexibility to help refine those needs for your clients. I also just want to call out that that language translation option does move whenever you've entered a zip code and you're starting to search into different resources. That language translation does move right underneath the search bar here. So I've had some folks get confused because it's here from our home page. but it does move to right up here. It's still there. It just kind of shifts places a bit. I see some, housing. I am going to type in, let's start with WIC. Or let's do SNAP, because I already have a WIC example I want to show y'all. So if I wanted to type in SNAP, just kind of connecting the dots between what Amber was going over and with what is directly on Find Help. This is just one way to really help a client or encourage them to self-navigate and start getting a feel for what benefits and services out there exist. You know, a lot of those kinds of hesitancies around judgment or bias or just complexity with the process, you know, Find Help is really trying to cut through all of those assumptions and biases and all that noise and really make sure that that person who's in need of help can quickly and easily connect with those programs to help meet that need. And so to that point, I just wanted to emphasize again that this is a tool that not only can you use, but that if your clients are, if you're sensing some hesitancy with them or with you helping them navigate and find resources, they themselves can directly self-navigate and search for resources through findhelp.org themselves. Now I know, you know, I kind of have a small amount of time. So what I'm going to do right quick is just show y'all a few additional ways to really help drill down into a client's need. I'll go over this program card and then I'll kind of hand it back over to Rachel. But where we're at here is, you know, we've typed in our zip code, we typed in our specific public benefit here. I'm still seeing 42 programs. That may be quite a bit still, or maybe you have specific criteria or you know, you need specific elements of the program, such as they need to be open late, or they need to be able to provide a specific language service. You can use these filters to leverage that, you know. So as I'm looking at these personal filters, you can see that I'm able to filter out on characteristics of the client that you're helping, you know, if they're a veteran, they're an immigrant, if they're underinsured, all these different kinds of considerations you're able to directly filter. Secondly, you know, perhaps you're helping a client who's transportation insecure, and you need to make sure that they are able to visit a program within 1 mile of that zip code you typed in. You can specify that here. You can, you know, specify, hey, I need it to be open on weekends. You can take a look at what language offerings the different programs have, and, you know, narrow in on programs that provide specific language support. And tying back again to some of those considerations like TANF and SNAP and WIC, being able to kind of browse through income eligibility considerations, household size, household income. There are a lot of different ways that you can really narrow in and not only ensure that you're finding programs that fit that need, but programs that fit the specific situation of your clients as well. And then lastly, what we call these different listings are our program cards. So every white rectangle that you're looking at is a program card. And each program card has a lot of different information related to that specific program. So we always list by program first. As you can see here, I typed in SNAP, and a lot of these programs have that SNAP program name, followed by the provider name. So a quick fun little note here, if you wanted to click the name of the program, it'll actually take you to a full page printable view of the program card. If you click the name of the provider, it'll take you to a provider view, and it'll actually show you all the programs we have listed for that provider, regardless of that initial zip code that you typed in. If I click more info, I'm going to see all sorts of detailed information about the program, eligibility, availability, a detailed description about what services they offer, language supports, costs, links to their different websites and social media pages. And I can also get a sense of, you know, what are the different geographies that they serve? When was this resource last reviewed? All sorts of great information about the program to really help your client or help you help your client find that specific service. You can also directly suggest a change to a program. So if you knew that, for example, this Bronx Works Snap Ed program wasn't open 9 to 5, that their hours had changed, you know, 8 to 4, you could type that message in and send it directly to our curation team. They will directly review that, ensure that it's accurate, and then update the listing within 2 business days. But one last thing I want to call out is the share option. And what's really cool about sharing is that you can share this program directly with your client through Find Help, through email, or through text, or even on Facebook. I kind of mentioned this one in passing because it basically just kind of lets you share it on your wall. As you can see here, it's popping up my Facebook page. But I can send a text directly to that client or an email directly to that client. And the last thing I want to emphasize about this is that if you select a language, so I'll just do Bulgarian here. Once I click send, not only will your message translate in Bulgarian in both the email and text options, but when that client clicks the link to the program that is in this message, it'll automatically translate the site into that language. So kind of tying back to that language barrier option, really trying to minimize language barriers in terms of getting a client connected with help. So I'm going to pop back over and just kind of summarize really quick what we covered here and then shift it back to you, Rachel. You can use Find Help to search for programs. You can share resources directly and even track client outcomes. I didn't get to touch on that today, but the good news is that if you're interested in learning more, we have different training sessions. Our 101 kind of goes deeper into the sort of searching and navigating features that I touched on here, whereas the 201 will touch on the different tools and features available to providers of services. And then you're always welcome to connect with me directly, book time with me directly. I'm always happy to kind of chat through how you can best use Find Help. And these slides will be shared with all of you at the end of the presentation. So I look forward to connecting with y'all later and appreciate y'all taking the time to learn more about how you can really demystify that process of searching and finding for help. So thank you all, and back over to you, Rachel.
Thanks so much, Colton. That was great. A few of our attendees had questions, and Colton will try to go through some of those and see if he can respond to any in writing. We might have time at the end to also go through some of your questions. So far, we've learned about some of the most used benefits, how to work with a client to identify eligibility and what might be available in their community. And so the last piece of this webinar we wanted to touch on is the benefits cliff, what it is and how it might impact the decisions that your clients are faced with, as well as your recommendations. With that, I'd love to welcome Shoshana Martyr with the LEAP Fund.
Hi, thank you, Rachel. Right, I'm going to share my screen here. Hello, everyone. I'm Shoshana. I'm the Senior Program Lead and Product Manager at LEAP Fund. And at LEAP Fund, our sole focus is the interaction of public benefits and income, more specifically benefits cliffs, as Rachel mentioned. So I'm sure y'all are dying to know, what is a benefits cliff? A benefits cliff is essentially earning $1 or $2 more an hour or adding a few extra hours at work, but as a result, losing critical public benefits that were worth much more than that increase. So you're making more to earn net less. Let's see what this looks like for Tanya. So Tanya is a single parent to a 3-year-old named Jenny. She's working at a fast casual restaurant as a cashier and is also receiving a childcare benefit, which is worth about $900 a month. And it's that childcare benefit that helps make sure that she can get to work on time and that Jenny is taken care of. So it's Tanya's work wages plus that childcare benefit that combined to make up her total income. Tanya has been excelling at work, and her manager pulls her aside to offer her a supervisor position, which would earn an additional $1.50 more an hour. So this might seem like a simple decision for Tanya, but her wages alone fail to tell that whole story. If Tanya accepts that promotion, her earnings would increase, but she would lose that $900 childcare benefit, which would decrease her total income. So that means Tanya is earning less, and she's also no longer able to make sure that Jenny is in daycare, which is creating both a financial, but also a logistical catastrophe for Tanya. So what Tanya just experienced is known as the benefits cliff. You might also know it as the cliff effect, or if you're really wild, you might know it in the context of marginal tax rates as well. What's extra confounding about benefits cliffs is that people often don't know that they're going to hit one until after it's already happened. So that means you have many people making financially conservative decisions like not taking a job or not taking a raise out of fear of losing those critical public benefits. So I know Allery and Ember talked a little bit about what public benefits are available and like what might different eligibility criteria be for them. So whenever there's a change in some of those eligibility criteria, that's where these cliffs might occur. So this includes a change in income, like a new job, or in Tanya's case, a promotion or a raise, or anytime there's a change in someone's household, like having another child, or if your son is graduating high school and is moving out for college. These are moments of change that might impact someone's public benefits and might cause those benefits cliffs. Just to be super clear, this is totally a policy failure that allows cliffs to exist in the first place. The only way to really eliminate benefits cliffs is to change the policies themselves. That is something at Leap Fund that we're hoping our data, our stories that we're gaining from our programs, that can help lend to. But we also know that there are many people in the policy space. It takes some time to change policy, and that there are less creating those on the ground solutions while we wait and while we push for that policy to change. Also want to be super clear that this mystery that exists around benefits and income and how they interact is also not the fault of people who receive public benefits. Unfortunately, benefits agencies aren't usually advising benefit recipients about these cliffs. And there are reasons for this. It's really complicated. There's lots of complications of how benefits are distributed by different agencies. And there are also different benefits across local, state, and federal agencies. But what this means is that it leaves benefit recipients with really no information. And when there's no set place for these conversations to happen, they end up cropping up everywhere. That's why at Leap Fund, we created our coaching program to help coaches navigate these benefits cliff conversations with their clients. So we are partnering with organizations to help their coaches unravel this tangle of public benefits and income. So we're training coaching organizations nationwide with the tools and the resources to identify benefits cliffs and benefits eligibility. This way, coaches can facilitate these conversations and give people the information they need to avoid that kind of fear-driven decision-making and move towards data-driven decision-making. We are working with organizations that are providing future planning coaching. So this includes financial coaches like you all, employment coaches, case managers, workforce development coaches, social workers, et cetera. As I mentioned, like these conversations are cropping up everywhere. So we want to tool up as many people as possible with the tools and the resources to talk about them. And our program is embedded within coaching as part of a holistic approach in helping a client meet their own goals and their own ambitions. So what this actually looks like, if your organization is working with Leap Fund, we provide three main things. So first is coach training to confidently lead these conversations with your clients. So this includes access to our professional development, asynchronous onboarding that takes coaches through topics like what are benefits cliffs, when might they come up for a client, how might you use our tools to talk about these things with clients? Whether you're familiar with benefits cliffs before joining our program or not, we want to make sure you feel tooled up and ready to actually sit down with the client and talk these things through with them. In addition to that training, we also have resources, scripts, scenario, guides, benefits 101 grounding to help guide those client next steps. So we are working with a range of coaches with various levels of expertise and benefits cliffs, but also public benefits more broadly. And I think as today highlights, like public benefits are just super complicated. So we're here to help demystify it. We don't expect anyone to become that expert after looking at our resources, but how might we help provide those next steps, those next resources to look and get more information. So we have resources around like what are some key terms to look out for to see if, oh, maybe benefits cliffs might be relevant for my client. Or how might certain specialized populations like non-citizens or veterans, how might they interact differently with the benefit system? Just some next step ideas to help coaches guide that conversation. And the last thing that the Leap Fund Benefits Coaching Program provides is our benefits cliff calculator that gives real number estimates and predictions, can show how a change in income or a change in household size, how that might impact the benefits that someone is receiving or predicted to eligible to receive. So make it really easy to see tangible number predictions for these benefits cliffs. All of this, our calculator, our resource, our training, it's all here to aid in that client decision-making and helping them plan what that first next step is. We always say, like, we do not have a stake in what choice people actually make, whether it's taking that job, not take that job, applying for a benefit. Like, we don't think that's for us at Leap Fund to say. Our goal is to provide coaches all the information so that they can give their clients all the information they need to make whatever decision it is that is best for them. So what this means for Tanya, who was just offered a promotion, offered that raise, if she was working with a coach who's part of the Leap Fund coaching program, they'd be able to create that holistic picture of her finances and use our calculator to explore how benefits cliffs affects her. In Tanya's case, it looks like she will be hitting a benefits cliff if she accepts that promotion. So with the coach, she's able to weigh her options, talk through different outcomes. How does this fit in with her larger career ambitions? Does she expect any upcoming raises in the near future after this? Are there ways that she can cover that cost of childcare? These are the type of conversations that her and her coach can now happen as Tanya can plan ahead and armed with this information, make that decision of whatever is best for her life, her finances, and have that time to plan and prepare for her future. So just to take a step back here on Leap Fund, we started in 2018 talking to people who receive public benefits and seeing that benefits cliffs are a problem that they were facing. So we created first the pilot of our coaching program with 10 organizations, expanded that to 40 organizations, and for the past year have been inviting more organizations to join our updated platform and program. So I just want to share a few of our learnings and our insights from running this program over the past couple of years. The first thing is that we're really seeing how prevalent benefits cliffs are for our clients. As close to 50% discovered that they will hit a benefits cliff through Leap Fund's tool. But we also know that the impact goes beyond just those who are hitting benefits cliffs, because there's also this fear that is really driving decision-making. So as an example, we found that for those who were familiar with the concept of benefits cliff, 63% said that they had made decisions like turning down a raise or more hours to avoid losing critical public benefits. So you have really a large number of people who are actually hitting benefits cliffs, and even this larger number of people who are making these financially conservative decisions because they're afraid of losing these benefits. And what's also interesting to learn is that even though many people are hitting benefits cliffs, still a majority of folks decided to take that advancements given this further context about impacts to our programs. So as an example of those who are weighing job decisions, 75% still planned on accepting a new job or more hours after using Leap Fund's tools to gain that transparency into their benefits and their jobs decisions. So for us, it just highlights why it's so important to be working with coaches. We know benefits cliffs are a crucial part of the conversation, but they're also a part of the conversation around people's larger ambitions and goals, around their career pathways, around what their what their future looks like. And benefits cliffs shouldn't be a conversation stopper. They should be a conversation starter around how does this actually work for the specific client and how their future can go. So we really found that our tools can spark those important financial health conversations. And just to highlight some feedback we've heard from partners on how our program provided new ways to discuss an issue that has been important in client coaching with clearly understandable results and actionable next steps. So just to summarize here, we know coaches of all specialties have clients who are facing benefits cliffs and that these conversations are popping up everywhere. Leap Fund can help coaches confidently navigate these conversations. Our calculator provides transparency for clients to make important life decisions based on real number estimate predictions and not fear. And with clarity, clients are able to plan for changes before they happen, whether that be accepting a new job, applying for benefits, or other big life decisions. So we are working with organizations that are providing this future planning coaching. If this sounds like an organization that you're working for, that you're volunteering for, we'd love to connect. If you are overdrafting your own emails, I get you. Same, to make life a little bit easier, we have a template that you can use to connect with your manager, just introducing what Leap Fund is. We'd love to connect. We'd love to explore if there's ways that we can be helpful to your organization. So you can either use this template over here that I think we're going to be sending out afterwards, or connect to us directly through info@myleapfund.com. Benefits cliffs are an unfortunate but common part of this user journey of receiving public benefits. But our goal at Leap Fund is to provide that transparency so people can really plan ahead and make data-driven decisions about their life, their finances, and their jobs. So with that, I will pass things back to Rachel.
Thank you so much, Shoshana. We have a few minutes for questions now. I know that Colton has been going through some of the questions answered in the Q&A and answering them, but I'm going to ask a few questions live. So maybe take a moment if you have any questions to write them in, and we'll try to get through as many possible. Shoshana, I'm going to start with a question for you. If you could just talk a little more about what data sources are incorporated into the benefit cliff calculator.
Yeah, so we're working with a partner who specialize in these benefits eligibility and these benefits predictions. Our program is nationwide, but we do show more robust feedback in different localities. So our benefits are specific to the zip code to that locality. That being said, we're not the benefits agencies who are administering these benefits, so our predictions are definitely predictions. But what we have found, it is really powerful to take this away from a big scary of, oh, you might lose your childcare, you might lose your food stamps, your SNAP, to, okay, it looks like you're likely to lose it, and it looks like it's going to be around this amount. So taking away from this big scary to these predictions, we have found has been super helpful for coaches and their clients.
Great. And so if someone was interested in finding an organization trained by the Leap Fund in their local area, is there a way to do that?
Right now, the best way is just to connect to us.
Okay.
We'd be happy to make those connections if possible.
Okay, great. And then let's see. Someone asked, can the calculator integrate a multifactorial analysis, taking into account the potential loss of childcare benefits versus possible increase in EITC as income moves along the line or the curve for each benefit?
Yeah, and I definitely appreciate also that me speaking about the calculator is very different from actually seeing it and getting that visual. So we're taking into account a bunch of benefits and showing how, if you were to adjust either their income or their household size, how will that impact the predictions, those eligibility for the specific benefits, and then that net income. So that's how we're predicting those benefits cliffs. If this is something that's relevant to your organization, would really love to connect and actually walk through what our platform looks like and what our calculator looks like.
And Shoshana, is Leap Fund currently working with AFC or AFC?
I don't think we're working with them in an official capacity, but
okay.
Big fans of the people there.
Yeah.
So I'm doing my math. I'm which one is that yet? Yeah, I think we're, like I said, these conversations are happening everywhere. So we really are eager and excited to connect with as many organizations as possible, so that our tools and our resources can be utilized by as many people as possible.
Thank you. And then Colton, a question for you. Can someone offer the findhelp.org link on their website? How would they do that?
Yes, absolutely. And I'll share my screen here for that one. So there's a couple of options. You can directly just embed findhelp.org, the link, onto your site. You can also set up a free, what we call our simple search box. So for example, this is the Virginia Department of Health, the Chesterfield Health District. They've embedded, and this is free, you can customize all the language. We have different options, whether you want just a zip code or a keyword. But this just allows you, it brings the Find Help search box directly to your site and allows for folks to go into a search on Find Help directly from your own site. So that's one option. Again, I mentioned you can just directly have findhelp.org embedded on your site as well. I'm jumping around here. One other option I didn't cover is save favorites folders. So I know a lot of folks often are asking, like, we want to make our own kind of resource directory. This is one of those free features of creating an account. Anyone who creates an account gets access to the ability to save programs directly into their own custom folders. And what you can actually do with those folders is create a link directly to that folder of resources, like a public facing link, such as in this case with some chronic disease self-management programs offered by the Virginia Department of Health. If I click this box, they've embedded that box with a link to a favorites folder that has those specific CDSMP and kind of some other diabetes prevention type programs here. So I can't remember who asked that, but to answer your question, yes. And there's a lot of different ways that you can directly link out, embed, and tailor the Find Help kind of programs depending on your specific needs. So if you're interested in that, please feel free to reach out to me, and I'm happy to kind of help support with next steps there.
And then Colton, another question for you, like how do you, you touched on this a little bit, but if you could just refresh us on where do you get your information and how do you ensure it's up to date?
Yeah, so we get our information from a variety of sources. I had mentioned that our curation team is our primary kind of research gurus. They are every day doing online research, but not just going to a website. They do the work of calling providers, emailing providers, again, ensuring that program information when we list it is accurate up until that time. And then in that kind of 6 to 12 month time frame, really aiming to ensure the accuracy and verifying that data. So again, that looks like emails, calling, checking in on website and Facebook pages, that kind of thing. That's just our curation team though. Another way we keep info up to date is by members of the public directly suggesting changes to a program, as well as providers of programs have the ability to claim their program. It's free. That's what unlocks the free program tools I briefly mentioned. When they do that, they're actually able to directly edit and update their own information. So kind of tying back to that public benefit piece, in DC, we were working with the DC WIC agency and their local providers. All of the local WIC agencies have claimed their program cards. They've also switched on one of our tools. And if I click more info, I can view it here too. This reviewed on date will tell you the most recent, when this was last reviewed. Then you can always look at last reviewed when you click more info. So all that to say, there are a variety of ways that we get programs listed and a variety of ways that we keep it up to date. But I kind of like to use our curation team as the baseline, that 6 to 12 month piece of keeping stuff accurate.
Thank you. And then one more, is there a cost for the 2 sessions, the 101 or the?
Oh, no. That's the beauty of my job, is that everything that I talk about as a community engagement manager is free. So that search box is free. This functionality is free. You signing up for those trainings, that's free. Creating an account's free. All that program management stuff that DC WIC is using, all that's free. So there's no cost and there's no limit to the amount of programs you can list and the amount of programs you can claim if you're a provider of a service. But yeah, feel free to attend that. There's no cost or like gotcha moments there. It's all free.
Wonderful. Thank you to the presenters so much. We really appreciated you being here today to share this important information. I just wanted to provide the AFC code for submitting for CE credit. It's FFP, so Frank, Pet 05, FFP 05. And we'll be sending a follow-up email that has some of the presentations as well as the code in case you need a reminder. And we'll also be posting the recording on our website in the coming weeks. So we really appreciate you being here. Please be in touch with me or with any of the presenters if you have additional questions. And we hope you'll join us in the future. We have a webinar coming up in August on diversity, equity, and inclusion featuring one of our grantees. So thanks again and have a great day.